Okay, I've got another great tip for you. For several years, I was the president of an auxiliary association for implant dentistry. That's my field. And one year after I had passed over the presidency to someone else, they invited me to be the luncheon keynote speaker. I went, but I didn't want to go empty-handed. So I started thinking, what can I do? What can I take staff members who work in implant dentistry that would be fun, that would be, something they would enjoy. So I had little canvas bags made with my new company logo on it. Joy was on the side. I took them little canvas bags and gave that to them. The other thing that I did was I had little buttons made, little fun little purple buttons made that said, "Ask me about implants." Now my staff looked at me and said, "Are you crazy? Have you lost your mind? Nobody's going to wear that." And I said, "Why not? I love it. Ask me about implants. Why wouldn't they wear it?" They said it should say, "Ask me about dental implants." Oh, well, I like it so much, I'll wear two. Ask me about, are they level? Maybe this one needs to come down a little lower. At any rate, I went to the convention. I took the buttons. We had a hilarious laughter. I mean, ladies were wearing them around the convention center, and people were just talking about implants. What's that? Tell me about that. Everywhere I speak, when I talk about implant dentistry, I'll have buttons. Invariably, people in the hotel or in the meeting facility will see the button, ask me about implants. In the hallway, I'll tell them about implants. I gave one of these to a great oral surgeon in Sacramento, California, a friend of mine. And I said, look at this, is this funny? What do you think of this? He said, "Oh, give me one. I'm going to give it to Joyce." Now, Joyce was his receptionist. Joyce would do anything, he said. She'll put it on proudly. I gave him the button. I called him later. I said, "What did Joyce say about the button?" He said, "Oh, Joy, it was third molar day in the oral surgery office." I didn't know you had third molar days, but they had third molar days. He said, "We were back in the back taking out wisdom teeth all day long. Joyce proudly put the button on her lapel, and she was greeting patients and family members waiting for the patients having the wisdom teeth out. He said, by noon she scheduled 2 implant evaluations." I said, "Not third molar patients." He said, "No, Joy. The family members in the reception room saw the button, said, 'What's this implant thing?' She told them and they scheduled." I said, "That's great. 2 before noon the first day with the button." Next thing that happened is she went to lunch and forgot to take off the button, he said. She got on the elevator in the same building she had worked for years and years, and in that same elevator stepped a man who worked in the same building she had known for 5 years. He didn't work in dentistry, but he saw the button. She'd forgotten to take it off. He said, "Joyce, I'm afraid to ask, but I think I have to. What's this implant thing?" She looked down, saw the button, said, "I forgot to take the button off," and told him about implants, and he scheduled an appointment for an evaluation. Had known them for 5 years, knew nothing about implant dentistry. If people don't see it, if they don't hear it, if they don't know what you do, they'll go somewhere else to get it. Anything will move them out of your practice. A billboard, an advertisement, anything will make them be lost. Had another surgeon that I gave a button to. He put it on his white coat. It was the clean white coat, the one without the blood stains, the one you would meet new patients with. He put it on the lapel and forgot it was there. He went into a patient who had been referred to him for tori removal. He did the evaluation, then talked to the man about the surgical procedure to remove the tori, and he said, "What questions do you have?" The patient says, "I don't have any questions about the tori or the surgery, but what is this implant thing?" The doctor was puzzled, but then realized, "Oh, you mean this?" And he told the patient about implants, and he said, "Implants are the perfect solution for you." See, he had looked at the patient and saw the patient as a tori patient. They're either third molar patients or tori patients, but what else could it be that they need that you're not focused on? When a patient is referred, we focus on what they were referred for. And certainly we don't want to blow them out of the water or lead them in the wrong path too soon, or the right path, too soon, I should say. But implant dentistry is wonderful and life-changing, and we're not doing it because people don't know we do. Thanks.